Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us on the program today. Our guest is Dr. Hilary Baldwin. She's the medical director of the Atlantic Health System's Acne Treatment and Research Center in Morristown, New Jersey. She's here to talk with us about some new data on how inflammation impacts acne scarring and how to prevent and possibly treat these scars if and when they do appear. Welcome to the program, Doctor.
Thank you very much for having me.
Thank you. You're a board-certified dermatologist. You've got a lot of experience. Your area of expertise and interest are acne, rosacea, and keloid scars. Does all acne cause scarring of some type, or are some of us able to get through it, never know that we had it unless we tell somebody?
Right. Well, I think, honestly, I think that nobody emerges unscathed from the acne process. If you have significant acne, if you have acne that is visible to the outside world, I believe that everybody ends up with psychological scarring as a result of having gone through the process. Also, everybody ends up with physical scarring to some extent. It just may not be visible to the naked eye. So what we're really talking about here, obviously, is scars that leave long-lasting imprints on the skin. And that is less common than acne itself, but there are some studies that suggest that 85 to 95% of patients have some scarring of some sort. Now, it may be on the chest, the back, the arms, or the face. So it does leave a mark on most everybody. Folks who are going to scar, unfortunately, are not necessarily predictable. It is definitely true that the more severe your acne, the more likely you are to scar. But in two studies, we saw that the moderate patients scarred in about 40-45% of the cases, and mild acne that barely met the radar screen formed scars in 20-25% of patients. So acne severity does not necessarily predict whether or not you're going to scar and how bad the scars are. In fact, I see patients coming into my office all the time who don't even notice that they're scarring. I have to sort of point it out to them that we'll notice here in your temples, especially, very common area, you do have some scarring, and I'm afraid that if we don't get this condition under control immediately, that this is going to be lifelong. Because we're treating acne. When patients walk in, we're treating them for their acne that day so that they look better and feel better about themselves. But also we sort of have to force them to make sure they adequately treat themselves so that they don't regret it when they're 30 and 40 and 50 and have acne scars that are permanent.
So not only can you get the acne can run its course, but you can be scarred for life if these scars aren't treated, adding to the psychosocial aspect of acne.
Exactly.
There are treatments that involve topical solutions, oral solutions, and laser solutions that we talked about in other segments. Are some of these solutions effective when it comes to the scarring of acne and not simply the treatment of acne? Right.
Well, there are, but overall, it's a heck of a lot easier to prevent the formation of scars than it is to treat them after the fact. There are some excellent methods for treating scars. Like you just mentioned, there's some topicals, there's some orals, laser and light for sure, doing a nice job, and excisions, surgery to remove it, and resurfacing techniques. So there are ways to deal with the scars after the fact, but they're quite expensive. They're lengthy treatments. Often you look a heck of a lot worse before you look better. And you go through a period of time when, if you're really doing a thorough job at treating acne scars, you're going to have to disappear from your social life for a good couple of weeks, maybe even a month. So it's way easier to prevent them than it is to treat them after the fact. And there are several studies now that demonstrate that the earlier you seek treatment for your acne, the less likely you are to scar. Two studies showing that if you sought treatment before 3 years into your acne, you were 3 times less likely to scar than if you waited. So I think the take-home message is don't wait to treat your acne. Whether or not you can appreciate the fact that you're scarring, you ought to be treated early and perhaps aggressively.
Are there any factors other than the severity or how long the patient has been dealing with acne that contribute to the effectiveness of one treatment or another, say an age group or maybe a gender,
Yes.
other factors than just the acne itself that lend themselves to better treat the scars?
Well, there are factors that lend themselves to more scarring. For whatever reason, men are more likely to scar. In some studies, in other studies, the women kept up with the men. But you have to wonder if that's because more women present to the healthcare professional with scars because they're more bothered by them, or do they actually have them more frequently? So that's sort of a mixed bag. Genetics is probably the overwhelming determinant as to whether or not you're going to scar. Darker skin, although not more likely to scar, can certainly scar with more hyperpigmentation, which looks more noticeable. But very pale skin tends to heal up with post-inflammatory erythema, with these red dots, which last forever, right? So there's all sorts of aspects of this condition. So I think overall, no, you can't predict who is going to scar in any fashion, except those that waited too long and perhaps for more severe patients. But predicting who's going to respond to therapy, not really.
Wow. Do you often find yourself having to dissuade a patient from one treatment or another because for some reason they find themselves convinced that this or that will work and they're looking for you to co-sign that?
Yes.
You have to say, based on what I know of your history, I suggest this, that, or the other?
Yeah, I agree, and I love the word co-sign because that's exactly what they're asking me to do. They're asking me to give them permission to not treat, or sometimes permission to treat with something that I feel is overly aggressive. So both sometimes occur. Sometimes it's from the patient, and sometimes it's from the parent. Occasionally, the patient drags the parent in kicking and screaming, and sometimes the parent brings the patient in kicking and screaming. So there's a dynamic within the family that sometimes needs to be dealt with as well. But yes, I try not to co-sign on something, obviously, that I think is not going to work or is inappropriate. But often I find that I have to start at the first visit entertaining the viewpoint of the patient in order to gain trust and to have it be a communication. This is, after all, their treatment. And then once it's not working as well as they had hoped, we move on to a more appropriate treatment.
When someone is experiencing scarring, is there pain? Is that something that they have to deal with when the scarring has occurred?
Yeah, hypertrophic scars and keloids are certainly painful. Now, there are several types of scars. Quickly, there are innies and outies. Innies don't often hurt. They're usually just physically unattractive to the patient. But the outies, the hypertrophic scars and the keloids, are often itchy or quite painful to touch, and, of course, much harder to treat.
When should a patient just abandon the over-the-counter medications and come to you for some serious help?
Well, I would say if the over-the-counter hasn't worked in 2 to 4 weeks, if you have a psychological overlay, which is to say that withdrawal from social situations, a decrease in scholastic performance, depression, certainly suicidal thoughts, or in some cases because of bullying and humiliation, actually homicidal thoughts, any of those things occurring, then you need help in multiple ways, but your acne needs to be dealt with to alleviate the psychological overlay. And then certainly if you see any physical scarring whatsoever. But the psychological is often more difficult to tell because a teenager is not often very forthcoming with their emotional with the emotional toll that it's taking on them. So it may sound self-serving since I'm a dermatologist, but I feel that anybody with acne significant enough to warrant walking into a pharmacy ought to be going to a dermatologist.
Some great information. Thank you so much for talking with us today, Dr. Baldwin.
Pleasure. Thank you very much for having me.
Thank you. You've been listening to Health Professional Radio with Dr. Hilary Baldwin, Medical Director of the Atlantic Health System's Acne Treatment and Research Center. I'm your host, Neal Howard. Here on Health Professional Radio, transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.